Imagine your doctor has prescribed you the same cholesterol medication for years, but there's a second medication, approved for 2 decades, that many doctors barely mention, and it might fill exactly the gap your current treatment leaves open. What if a simple, well-studied medication could further lower your risk of heart attack and stroke, and you'd never even heard of it? Stay with me, because this could change how you think about your own cholesterol treatment. Welcome back to Lebenspulse. If this video helps you, please consider leaving a like and subscribing to the channel so you don't miss important health information. My name is Dr. Adrian Vogel. I've spent more than 20 years working in internal medicine with a focus on cardiovascular and metabolic health, and during that time I've supported countless patients in bringing their cholesterol seek, and with it, their heart risk, under control. Before we get into it, let me share something that surprises even attentive patients. There was a moment in medical research when one of today's widely used cholesterol medications nearly faded into obscurity because a single study raised doubts worldwide, and it took years before the full picture became clear. Stay until the end, because that story shows exactly how careful we have to be with early study results, and it may well be relevant to your own treatment. Let's start with the basics. Cholesterol itself isn't inherently bad. Our bodies need it for cell membranes, hormones, and digestion. The problem arises when so-called LDL cholesterol, often called bad cholesterol, stays elevated over time because it builds up in artery walls and drives atherosclerosis, the narrowing and stiffening of arteries that can ultimately lead to a heart attack or stroke. The most commonly prescribed medication class for this is statins, and for good reason. They very effectively reduce the liver's own cholesterol production and are backed by decades of research. But here's the point. Many patients don't know. Not everyone reaches their target LDL level on a statin alone. Some people don't tolerate higher doses well due to muscle-related side effects, and some simply have a cholesterol profile that benefits from an additional mechanism of action. For exactly this situation, a medication was approved back in 2002 that works through a completely different pathway than statins, Ezetimib. While statins reduce cholesterol production in the liver, Ezetimib specifically blocks cholesterol absorption in the small intestine, so less cholesterol ever enters the bloodstream in the first place. Combining both mechanisms often lowers LDL far more than a statin alone ever could. Sounds like an obvious solution, doesn't it? That's exactly what many doctors thought at first too. And that's where the story I promised you begins. In 2008, the results of a study known as the ENHANCE trial were published, and it caused uncertainty around the world. The study showed that combining ezetimib with a statin strongly lowered LDL, but a specific imaging measurement of artery wall thickness showed no additional improvement compared to the statin alone. Media outlets picked this up, and the simplified headline many people remembered was, "It lowers LDL, but does it really protect the heart?" That uncertainty lingered in clinical practice for years, and it's still part of the reason some doctors remain cautious about prescribing it today, even though far more research has been done since. This is actually an important lesson for you as a patient. A single study using a surrogate measurement doesn't definitively answer whether a medication actually prevents heart attacks. For that, you need what's called a hard endpoint trial, one that directly tracks whether people actually have fewer heart attacks or strokes, and exactly that kind of trial eventually came along. 7 years after the ENHANCE trial in 2015, the results of the IMPROVE-IT trial were published in the New England Journal of Medicine, one of the largest and most carefully conducted studies on this exact question. More than 18,000 patients who had already experienced a heart attack or another acute cardiac event were followed for several years. One group received a statin alone, the other group received the statin combined with ezetimib. The result was clear. The combination therapy not only lowered LDL cholesterol further, it actually reduced the risk of major cardiovascular events, such as heart attack or stroke, compared with statin therapy alone. That finally answered the key question left open by the ENHANCE trial. Yes, the additional LDL reduction from ezetimib does translate into measurable protection for the heart and blood vessels. That's the story I promised you at the start. A medication that sat in the shadows for years because of a single misunderstood study, even though much larger, later research clearly confirmed its benefit. Let's pause here for a moment, because what I'm about to say matters a great deal. Everything in this video is intended for general informational purposes only and does not replace individual medical advice. Cholesterol levels, pre-existing conditions, other medications, and personal risk factors differ from person to person, and only your treating doctor can assess whether and which therapy is right for you specifically. So please talk to your physician before making any changes to your medication. Now you might be wondering, if the data is this clear, why is ezetimib still prescribed less often than you'd expect? Several quite ordinary reasons explain this, with no conspiracy involved. First, a medication's reputation often lingers in people's minds longer than the evidence justifies, sometimes called clinical inertia in medicine. Second, many treatment guidelines position ezetimib as a second step, used once a statin alone isn't enough, so in everyday practice it's simply used less often than the statin itself. And third, it takes time for new study results to actually change everyday prescribing habits. That pattern shows up again and again in medicine. But that's exactly why it's worth being informed, and worth actively asking your doctor at your next appointment whether combination therapy might make sense for your situation, especially if your LDL target isn't being reached with a statin alone. Something else many people don't know. In clinical trials, ezetimib has shown a side effect profile quite similar to placebo in many studies, which makes it an interesting option for people who can't tolerate higher statin doses. That, of course, doesn't change the fact that every treatment decision needs to be made individually together with your doctor. The real lesson from this whole story is actually reassuring. Medicine is a learning process. Early uncertainties get clarified by better, larger studies, and that's exactly what happened with ezetimib. So the next time you hear about a medication that got a bad reputation because of one single study, it's worth asking about the larger, more recent research before forming a final judgment. I hope this video gave you a clearer view of a topic that affects a lot of people directly. If you enjoyed it, please leave a like, share it with someone who might benefit, and subscribe to Lebenspulse so you keep getting well-informed, evidence-based health content. If you or someone you know has experienced this condition, share this video with them and tell us in the comments, which city are you watching from? We love hearing from our Lebenspulse community around the world.